Are we good?
This might be linked to the air traffic control system.
Yeah. Okay, very good. Yeah. Welcome to the first Labor and Health meeting, Senate Labor and Health meeting of the 67th Legislature. It's good to see smiling faces. Not a lot of you, but at least you're all smiling. We're going to forego the roll call because I think we can see that all 5 of us are here. Just a quick reminder, if anybody's got cell phones on, and this is a throwback to Elaine Harvey days, and Senator Barlow will remember this. If a cell phone goes off, you bring donuts to the next meeting. So leave it on, turn it off, it's up to you. We don't need the donuts, but if we're forced to eat them, we will. Okay, we've got 2 bills that we're going to hear this morning. They're both committee bills, although our old committee members are not as many as normal, so some people won't remember these bills, but they're pretty straightforward and simple. We picked them on purpose so that we could keep the training wheels on and sort of get a slow start here and go easily as we work into heavier things. I will warn you that probably by Monday, the training wheels come off and things will pick up the pace, and there will be a lot more people in here talking with us. So this morning, we're going to talk with Senate File 4, the North American Industry Classification System Amendments. Pretty straightforward, simple concept. This brings us in line with the North American Industry Classification System Manual. It brings the Wyoming statutes up to date with that and keeps us compliant. We can go through the bill, but as you can see, it's not a very long bill, not a very wordy bill, but that's the basis of what it does. It changes the language in here, renumbers, and brings us into compliance with the national code. With that in mind, let's just jump right in, and if there's anybody who wishes to testify to this, I know there's at least 1 or 2 people out there that really want to get up. Let's go ahead, sir, or go ahead and jump up. And you can bring up more than 1 at a time. All 7 of you can come up if you want. Go ahead and introduce yourselves, and welcome to committee.
Thank you, Mr. Chairman. It's a pleasure to be here. My name is Robin Cooley. I'm the director of the Wyoming Department of Workforce Services. And I thought for this first bill, I'd come over and introduce myself, and as well as my administrator of workforce standards, Mr. Jason Wolf. And with that, I will turn it over to him, who is the expert on all things around this bill. So turn it over to him.
Yeah, thank you, expert of all things. You could stop there. That's good. Go ahead, sir.
Yeah, thank you, Chairman Baldwin, members of the committee. Yeah, Senate File 4, a bill that we just requested, like Senator Baldwin said, to clean up what we call the coverage statute, which is 2714-108 of the Workers' Comp Act. Really, it does just 4 to 5 little updates. The NAICS manual is something that is updated on every 5 years. Typically, changes are very minor, and you don't usually see numbering changes to the statute that are required. However, this year, 2022, the manual updates consolidated some codes and expanded others, and as a result of that is why we need this change, just to make the numbers accurate according to the manual. I would note this is not adding any other employers that are required coverage. It simply is updating those numbers to be in line with the 2022 NAICS manual. With that, Chairman, I just kind of walk you through the bill, if that's okay.
Go ahead.
Let's see, the first update is on page 2, line 10. It just updates those numbers of the wholesale trade sector 42. You'll see that it simply just updates those numbers from the blue number to the red number, all the way down through page 3, and then page 3, line 7. You'll see that skips into the retail trade sector 44, 45. I think there's a few updates there just regarding the retail trade sector, and that goes into page 4. The next sector there is page 4, line 10, the information sector 51, and there is 2 changes in that sector. And then lastly, bottom of page 4, line 18 is Sector 92, the Public Administration Sector. This was, page 5, line 4 was an error, I think, in the last update to this statute. You'll see that line 4 specifies NAICS Industry 92215, which actually, per the NAICS manual, is parole officers and probation offices. So that just makes that necessary update, and then adds in, which was already required under the statute, page 5, line 14, the NAICS Industry 92216, which is your fire protection, volunteer firefighters, et cetera. So, and with that, Chairman, is very quick and dirty walkthrough of the bill, and would stand for any questions, sir.
Very good. I believe Senator Hutchins has a question for you.
Oh, thank you, Mr. Chairman. Mr. Wolf, thank you so much for the presentation. As I was reading this bill again, I was thinking about the different kind of nomenclatures. We're hearing national standards, and I'm also seeing it's a North American Industry Classification System Manual. How does this manual come about? Is it, I don't want to say it's national. Did the states get together and say, okay, these are the codes we want to put together to create a manual for everyone to follow? How do we come to agree with this? And yeah, those are my basic questions. Thank you.
Mr.
Mr. Wolf.
Chairman, Senator Hutchins, great question. I do believe that the North American Industry Classification System is actually an offshoot of the Bureau of Labor Statistics. So it is a national manual. It's widely used by insurance companies throughout the US to classify businesses into a specific industry, whereby that determines what kind of premium is charged for that business. Same with your auto insurance or homeowners insurance. That all has a NAICS code that is determined, and then the insurance companies determine premium based off of that.
Excellent. That really helped. Thank you, Mr. Chairman.
Thank you. Further questions, committee? I have a question. What are the consequences if we don't do this?
Mr. Chairman, another great question. So, as I said, 2714-108 is, was at some point in time by this body determined the businesses that must have workers' compensation. So the NAICS codes are all outlined by name and industry. So, you know, the wholesale trade sector, for example, we already know the trade sectors that this body wanted to have coverage. So this is merely just, I mean, we would have a, I guess, a short answer to your question is we would just have a dirty statute by which we'd have to fumble through and make sure that, you know, XYZ fencing company is actually required to have coverage. So.
Very good. Thank you. Further questions, committee? Senator Barlow.
Thank you, Mr. Chairman. So my question is regarding the repealer, non-store retailers. It's just something that doesn't even exist anymore in the classification system, or something that we don't have. And we can look at it later, Mr. Chairman, if it doesn't come to mind, but it gets rid of direct selling establishments as an industry group. It gets rid of, there's actually two subcodes underneath it, it looks to me like. So I just curious, non-store retailers.
Let's see, Mr. Chairman, Senator Barlow, what page are you on?
Mr. Chairman, it's the repealer is on page 5, the bottom, section 2.
Give me 1 second,
Yep.
let me.
Amending the form of changes, it must be something that's taken out of the code.
Yeah, right. Yeah. While he's looking that up, staff, we would request that maybe you make a note on the page 1. It mentions amending, but it doesn't mention repealing. And we probably need to mention that in the title, since we are repealing something. Go ahead, Senator Barlow.
Thank you, Mr. Chairman. So this is under retail, and it's a subsector under retail, non-retail retailer, non-store retailers. And under that, there's at least one classification, and it's, the way I read the statute, it's direct selling establishments, and under that is fuel dealers.
So,
Thank you.
yeah, thank you.
Go ahead, Mr. Wolf.
Yep, Chairman Baldwin, Senator Barlow. This particular sector, what it did was collapse several different codes into one code. And that's what's being repealed, is those other codes that that no longer are active in the NAICS manual because they were all collapsed into a single code.
Okay, thank you. Further questions, committee?
Chairman,
Senator Dockstader.
Mr. Wolf, page 5, we have the word firefighters, line 15. You noted the word volunteer firefighters, to just the word firefighters, that covers it. And as I look at this, we cover the competition and so forth. This would even cover them, if it's volunteer firefighters, they're doing everything from helping parades. What if they fall off a fire truck? What if they're hanging the Christmas lights fall out of the bucket? All of this is covered in summary for this.
Go ahead, Mr. Wolf.
Yes, Mr. Chairman, Senator Dockstader, yep. So there's actually another section of 108 that specifically discusses volunteer firefighters. So
Okay, so that's already covered.
it's already covered.
Thanks, Mr. Chairman.
Thank you. That was actually the most active conversation we had in the interim, was why the firefighters got drawn out into a whole paragraph. But anyway, Senator Bouchard.
Yeah, thank you, Mr. Chairman. I mean, what I'm looking at here is this was actually developed between Canada, Mexico, and the United States, but it looks like it was basically statistical gathering information is mostly what I see, and then all the government agencies use that information accordingly. So I mean, and it says in the original implementation is that every 5 years they would reclassify things. So I don't think, that's how I see this. This is straightforward and simple. It doesn't even affect coverage on workman's comp. I mean, because you guys handle that in a whole different section. So, right, is that correct?
Yep, Mr. Chairman Baldwin, Senator Bouchard, that's very accurate, yes.
Very good forming a question. That was good. Any further questions, committee? No further questions. Anybody from the audience, public, would like to testify on this bill? No emotional testimony. Anybody online? Nobody online. That will close the public testimony. Committee, what's your pleasure? Move to pass by Senator Dockstader. Customary in as we don't look for a second with 5 of us. Discussion committee. Amendments, discussion. Any move? Senator Barlow wants to say something. I can see it in his eyes.
Mr. Chairman, so I think the good Senator Hutchins was accurate in pointing out that we may need a repealer in the short title. And so we could make that note, and if staff believes that is accurate, we could have an amendment for we can do it as a committee of the whole amendment, I guess. We're not confident about it, but however you want to do it, Mr. Chairman. I mean, I'd move for a standing committee meeting amendment if you would like, but.
Let's do a standing committee.
Yeah, I'd move for a standing committee amendment to adjust the short title, or the title to include a repealer section.
Okay, committee, any comments, discussion? Sounds like a great idea to me. Staff, got that? Very good. Vote, all in favor of the amendment by Senator Barlow to add a repeal to the short title, please say aye. None opposed, that amendment passes. Any further amendments or suggestions or discussion, committee? Hearing none, I believe we're ready for roll call vote. And I failed to introduce, I'm sorry, we have a new secretary with our group. And I think she should introduce herself. Maybe after we do roll call, she could introduce herself to us.
Senator Barlow. Senator Bouchard. Senator Dockstader. Senator Hutchings.
For me, this is awesome. Aye.
And Chairman Baldwin. We have 5 ayes.
5 ayes, that vote passes. We'll go to the floor. Does anybody on the committee have a burning desire to present that on the floor? Senator Barlow volunteers. Thank you very much, Senator Barlow. And I believe we're going to do that this afternoon, if I'm not mistaken. No rest for the weary. Now, with that in mind, Madam Secretary Darling, would you mind introducing yourself to the committee? And I apologize for not recognizing you sooner.
No problems. I believe I've met you all individually. I am Doreen Cash Glotzer. I am going to assist you for the 67th legislature for labor and as well as travel, if any of you are on my committee there.
Welcome to labor.
Thank you.
We promise to be gentle and be nice. And if we're not, please let us know. Okay. With that committee, let's move on to Senate File 11, Cancer Early Detection Amendments. And if you thought the first one was a simple one, this one's simpler. What this bill does, this also is a committee bill from the interim, and with a little bit of background, very little background, is the recommendations for cancer screening for colonoscopy have changed, and no doubt are likely to change again through time, as most medicine does. The recommended time for screening changed from 50 years old to 45 years old. Our statutes, if you look on page 2, only talked about age requirements, making the patients have to be 50 years old or older, and that's not applicable anymore, as they're recommending people younger. And I would state only that's in here, as you'll see some of our other bills, changes happen, like the definitions of drugs, et cetera. If we can make them more generic where it covers those changes, when it's effective, it makes more sense. And that's what this bill does. It only makes one other change, and that's the change from a voucher system to a repayment of the debt incurred from the colonoscopy. And finally, when that funds is used up, when those funds are used up, we create a waiting list. With that in mind, I know there's at least one person out there that would love to testify in this. Go ahead and come on up. Welcome to Labor and Health.
Good morning, Chairman Baldwin, committee members. Stephanie Pyle, I'm the Senior Administrator of the Public Health Division at the Wyoming Department of Health. And Chairman, you did an excellent job of walking through the bill. So we are simply here to answer any questions that the committee may have.
You get brownie points by complimenting the chairman, by the way. Committee members, any questions? Senator Barlow.
Thank you, Mr. Chairman, and I will apologize a little bit. I served on this committee on the House side for 8 years, but after 2 years off, I have to be reminded. So I guess, what is the average number of folks who actually take advantage of this program, 5-year average or whatever it might be, Mr. Chairman, Ms. Pyle? And then what is the current rate that this would establish? What is our Medicare rate for the state of Wyoming, which would be reimbursed under this? Thank you, Mr. Chairman.
Go ahead.
Mr. Chairman, Senator Barlow, I have with me Star Jones, who is our Cancer and Chronic Disease Unit Manager, and she will be able to answer those questions.
Good morning. Thank you, Mr. Chairman and members of the committees. As Stephanie said, my name is Star Jones, and I'm the Cancer and Chronic Disease Unit Manager at the Department of Health. On average, we have roughly about 200 Wyoming residents who do participate with the colorectal cancer screening program. And for this last year, 2022, we denied 72 residents because of the age restriction that's outlined in this statute. So if we did allow those, we would be up to probably about 250 to 300 on average. And the reimbursements for colonoscopies depends on the number of polyps or the anesthesia. So on average, it is about $1,700 for reimbursement for Medicare, or Medicaid rates, sorry.
Very good. Further questions, committee? Senator Dockstader.
Mr. Chairman. So, Ms. Jones, how do they know about this? Do their providers say there's a program here that you might be able to tap into and use? How are these 200? I'm thinking about the population across the state. I don't know how many cases we have, but that number seems a little low. How do people know that they have this resource?
Ms. Jones?
Mr. Chairman, Senator Dockstader. So we do work with providers around the state. This program is specifically geared towards low-income, underinsured, and uninsured individuals. So that's roughly about 14% of the population. So that's why the numbers are low. We do some marketing and advertisement, and we work with federally qualified health centers to identify those patients that may not have insurance and may not be aware of this program.
Mr. Chairman,
Go
follow up.
ahead.
Then the provider will determine whether the person has the funds to pay this, and then they might say to them, here's how you do the program. Do they help them? Are they helping them? Or does the patient go out and try to figure this out on their own?
Ms. Jones?
Mr. Chairman, Senator, yes, provider offices do have patient navigators or discharge planners that help them fill out the application. We do work closely with those specific staff members at the provider's office.
Thank you.
Further questions? Senator Barlow?
Thank you, Mr. Chairman. So to that point, the providers, what's the mix of providers that you have taking part in this program? Is it primarily coming from practitioners, doctors' offices that are doing this, or is it coming from, where's it coming from? We have clinics, we have different things. What setting or is it all across the board? Thank you, Mr. Chairman.
Mr. Chairman, Senator Barlow, it is exactly all across the board. So typically a provider will recommend the colonoscopy and the patient will have to go to a surgery center to have that done. And so when they're having the consult with the surgery center, that's another opportunity where they can discuss the financial needs of the patient. And then this program is discussed at those appointments.
And I will tell you, just on part of my office, we have a sign on the wall that advertises it. And I would also put a plug in. I don't like electronic medical records much, but I'll put a plug in for them this once. And that is, we get a tickler that comes up every time we see a patient that's over 45 that says, hey, have you asked them about a colonoscopy? And we have to put that in the chart. It's part of our record keeping. So we have reminders everywhere. We have reminders on the wall. We have reminders in the chart. And then typically what most offices will do is refer to a surgeon or whoever's doing the colonoscopy. In some cases, just a general practitioner, but we do that referral. And most of the funding and most of that application is coming out of those offices, I believe. So just a personal side. Further questions go ahead, Senator Barlow.
Thank you, Mr. Chairman. So is there a value in actually making this effective immediately instead of waiting until July 1st? Is your program actually make this change? If we're talking about 72 people and waiting four or five more months, that's a third of that population that might have the opportunity, and we're probably going to detect something in one of those people. I don't know what the statistics are. So my question is, what would you say about us adjusting the effective date? Thank you.
Chairman Baldwin, Senator Barlow, we have had two providers, one here from Cheyenne Regional Medical Center and one from Gastroenterology in Casper, that have been very vocal about this limitation restricting the number of people that are able to get screened. Cheyenne Regional currently has 5 patients that are waiting to have a colonoscopy to the age of 50. And so that's only 5 people. I don't have a personal preference on whether it's now or in July, but we have had providers that reached out with concerns.
Go ahead, Senator Barlow.
Thank you. So, and maybe this is not the question because for you, or maybe it's for a provider, but what percentage of these colonoscopies yield results that need intervention? And not these, just general screening colonoscopies. What percentage need further intervention? Thank you.
Ms. Jones.
Chairman Baldwin, Senator Barlow. The data that the United States Preventative Services Task Force utilized to recommend the age change showed that 40% of people who were diagnosed with cancer under the age of 50, or between 45 and 50, would have survived if they were diagnosed earlier. So it is a relatively high risk of death if you don't diagnose it early. Does that answer your question?
I believe so. Further questions? Go ahead, Senator Bouchard.
Thank you, Mr. Chairman. I have a question based on where this whole industry has went. We've went from physical inspection to blood biomarker. So has this program also shifted to that as well? Is there reimbursement for biomarker tests and related tests like that?
Ms. Jones?
Chairman Baldwin, Senator Bouchard, the rules that are also accompanying the statute do allow for the at-home stool-based testing options, which include the fecal immunoco, the FIT test, which does test for blood. It also covers the Cologuard, which is the FIT DNA test. So those codes have been added to the colorectal cancer screening program within the last year. Many providers are still new to that, so it hasn't been utilized as well as it could have been, but it is allowed.
Follow up. Go ahead, Senator Bouchard.
Thank you, Mr. Chairman. So, and maybe nothing to do with this bill, but I'm asking, do we have to do something at our level to maybe bring that in more? Because that seems we save a lot of money doing it that way, and maybe even doing it earlier on. So anyway, not really a direct question about the bill, but what's your feelings on that? I mean, could we potentially save a lot of money by doing a major shift and overhaul in that area?
Chairman Baldwin, Senator Bouchard. The average reimbursement for a FIT test is around $27, and for a Cologuard, it's about $500. So yes, it is a cost saving, but that is only, those tests are only recommended for residents who are of average risk, who are not having any symptoms. And so the education around that for providers would be to make sure that they're recommending that to any patient who is not exhibiting any symptoms such as bleeding, any kind of gastrointestinal issues, no family history of colon cancer. And so those are definitely very great options in lieu of a colonoscopy, but colonoscopy should also be available for people who are having symptoms.
Very good. Further questions, committee?
Just a quick one, Mr.
Go ahead,
Chairman.
Senator Dockstader.
Are we getting the word out to the rural areas? I hear you mentioned Cheyenne, and life tends to revolve around Cheyenne. What about our little rural areas all across the state?
Go ahead, Ms. Jones.
Chairman Baldwin, Senator Dockstader, yes, we do serve statewide. I just mentioned Cheyenne and Casper because those providers had recently reached out. We previously had run a FIT kit program where we provided those at-home stool testing options statewide, and we did have a lot of rural clinics that utilized those. We transitioned in 2021 to allow those as covered by this cancer screening program, and many clinics are just starting that process on getting that established in their clinics. Throughout this next year, that is one of our program goals, is to work with those rural clinics to just make sure that they have that as available as an option, and then to also address any kind of access concern or transportation concerns for people going from a small clinic to a surgery center in the next town over.
Thank you.
Very good. Further questions, committee? All good questions. Very good. Thank you very much. Anyone else in the audience? Come on up. Go ahead and introduce yourself. Welcome to Labor and Health. Bright and early on a Wednesday morning.
I'm having trouble. Oh, it's on. Okay, great. Good morning, Chairman Baldwin and members of the committee. For the record, my name is Kristen Page Nye, and I'm here representing the American Cancer Society Cancer Action Network, and as their government relations director covering Wyoming and Montana, and new to Wyoming, so learning your process. Definitely think this is a smart bill to modernize the language as it relates to eligibility. A couple things that we'd like you to consider. Just looked at this bill in the last 2 days, or I would have talked to the department. We'd like you to consider striking the 1-year eligibility portion And the reason being is it's so important in the fight against cancer that we not delay, whether it's early detection or treatment. So we really strongly recommend that you consider striking that. And then, go ahead.
Can you point out to us exactly where you're
Sure,
talking
so
about?
that would be Section D, the very first part, the eligibility, to strike that 1 year.
Okay, thank you. Go ahead and proceed.
Great. And then the second would be in the language, the amended language about the national screening guidelines, that you replace national screening guidelines and add in accordance to the U.S. Preventative Services Task Force guidelines. Those are like the national guidelines. They're fact-based, evidence-based, and just feel like it would be, our organization feels like it would be important to refer to the specific guidelines that are the national standards.
Can you just give us that language one more time, if you would?
Sure. So instead of the national screening guidelines, put in accordance to the U.S. Preventative Services Task Force guidelines.
Where I guess I'm not seeing that on the bill. Where exactly is it?
It's the amended language.
Oh. Okay, line 12, where it says with national evidence-based recommendations.
Mm-hmm.
Okay.
And just replace the national and include the U.S. Preventative Services Task Force.
Okay, very good.
Great.
Okay.
Any questions for me?
Questions, committee?
Yes, Mr.
Senator
Chairman.
Hutchins, go ahead.
Thank you. Mrs., let me see, page 9.
Yes.
Who is this task force?
So
Go ahead, Ms. Nye.
thank you, Chairman, and Senator Hutchins. This is, I'm probably not the best person to respond to what that task force is made up of, but it is the national. May I ask the experts on this? I'm more policy, they're more
You may,
experts
come on
on.
back up. She liked that chair up there anyway.
I just don't want to misstate it.
Nope, that's great. This is a lifeline, as they call it on a game show.
Thank you.
Go ahead, Ms. Jones.
Sure. The United States Preventative Services Task Force is a panel of 16 experts who have been called because they are experts in their field. They do serve a term, and they are asked by the committee to review recommendations on an average of 5-year basis. So they don't just do cancer recommendations, they do diabetes, hypertension, childhood recommendations. So it's just a national panel of 16 experts.
Thank you. Further questions, committee? Oh,
Mr. Chairman.
Senator Hutchins has a follow-up, I believe.
Chairman, just a quick comment. My concern in removing that 1-year requirement is this is a Wyoming program. And if we remove that requirement, we open up the door to people just coming into our state, taking advantage of a Wyoming service that have no intention of living here and then leaving. So just a concern. Thank you, Mr. Chairman.
Phrase that as a question. If you
Do you feel that that's a valid concern?
Thank you.
Thank you, ma'am.
Go ahead, Ms. Nye.
Chairman Baldwin and Senator Hutchins, absolutely, all of your concerns are valid concerns, and you guys are fiscally responsible. As you heard earlier, most people know about these screenings from their providers who are in Wyoming. So I think that it's our opinion that it would be worth that risk.
A little bit follow.
Senator Dockstader.
Thank you. And maybe I'm not overly concerned, 200 people roughly using it. I don't know, we may get some more, but what would happen if we had another 200? What's the cost? Who picks up the tab?
Ms. Jones?
Chairman Baldwin, Senator Dockstader. In the event that there were more patients enrolling in the program than we had funding for, we would have to elicit a waiting period and some kind of hierarchy of priority. So, number one priority would be patients who are having symptoms that needed immediate assistance. we could establish some type of priority where if they were a Wyoming resident for less than 1 year, they would receive lower on the list. You know, I don't know exactly what that could look like or what the numbers would look like. I did not look at how many patients we denied because of their residency. I could go back and look at that information if you'd like. We do track that, the reason for the denials. But if we did exceed the
Probably
number.
not necessary. Numbers are probably minimal, Mr. Chairman.
Go ahead.
Numbers are probably minimal, but it's just a thought there. I'm going to be a little hesitant if that's a minute. Thank you.
Further questions, Senator Barlow?
Thank you, Mr. Chairman. So, and I do appreciate the, what's been brought forth by the Kansas Society. One thing that I guess now I'm seeing another potential disconnect is the 1 year of residency, that's one, but the next sentence, line 3, says every 10 years. So what is actually the national recommendations out of this organization for high-risk people? I can't imagine it's once every 10 years. So, I mean, it seems like we have another question that I need answered because maybe we're creating another, or there's now a different inconsistency with these national standards. Thank you, Mr. Chairman.
Very good question, Ms. Jones.
Chairman Baldwin, Senator Barlow, there is another section in the statute that elaborates that the recommendations would be based on what the provider finds. So on average, the standard is a 10-year colonoscopy, but if they do have polyps removed or if they have any other symptoms, the recommendation may be 7 years, maybe 5 years. And so I would have to read through this to find the exact sentence, but it is identified somewhere further in the statute that says that they can go by provider recommendation.
Very good. Further questions, committee? Senator Bouchard.
Thank you, Mr. Chairman. I just have one question because we talked about the reimbursement rates. So, and because my concern here is maybe I don't want to have so much heartburn or have anybody have heartburn in this bill, that what is the actual cost versus the reimbursement? Because I don't see this as being something astronomical where even if push came to shove, somebody could get a friend or relative to help them with the cost of this. So that's why I'm looking at, you know, obviously the 1 year thing. I'm not there removing that because of the same concerns of Senator Hutchings. And I think if we set precedent on residency on this, it opens up a door on many other things. So back to that cost issue, I don't see it being so huge. Someone can't get picked up in the program, possibly they can do this another way. So I just want to know what your feeling is on that.
Ms. Jones?
Chairman Baldwin, Senator Bouchard, this program is geared towards people who don't have the financial means to pay for those colonoscopies. So it would be difficult for them to find those funds. There are other opportunities available. So some hospitals or foundations have charity care or other opportunities where they can assist with making a payment plan with the patient or reducing the cost. I don't know what the cost of a colonoscopy is without an insurance adjustment, such as the Medicare rate. I would have to go back and look at just what the standard fee is. And I'm assuming that would vary from hospital to hospital. The reimbursement for Medicaid is lower because it's a Medicaid reimbursement, but the standard cost without an insurance adjustment would be a lot higher than that. Does that answer your question?
Further questions, committee? Just a quick question. You know, and since the inception of the program, have we ever had to institute a waiting list? Or have we always been able to get everybody in? And how many people would have been on that waiting list?
Chairman Baldwin, we did institute a waiting list in 2014, but I do not know how many people were put on that wait list because it was prior to my time at the state. But it did not last very long, and that was the only year that we instituted it.
Very good, thank you. Further questions, committee? Thank you very much. Anyone else who wishes to testify to the bill? Anyone online? Okay, everybody's asleep at home. We'll close public testimony. Committee, what's your pleasure? Move to pass by Barlow. Discussion amendments. Let's just work our way through the bill, page 1. Anybody got anything there? Page 2. Page 3. I believe somebody wanted them effective immediately. Go ahead, Senator Barlow.
Thank you, Mr. Chairman. So I would propose to amend section 2 to effective, the standard effective immediately language that our LSO uses.
Second on that amendment by Dockstader. Any discussion? No discussion. Vote on that. All in favor of that amendment by Senator Barlow to change to effective immediately, please say aye.
Aye.
Any opposed, say no. That amendment passes. Any further discussion on the bill? Senator Barlow.
Thank you, Mr. Chairman. And I do appreciate the suggestion about being specific about the preventive services task force, et cetera. I do think that, and there are times when we get very specific that we have to go back and change things. And so having a little broader language, in my perspective, is, I'm not saying it's preferable, but we may not have to revisit it because, you know, there's a change in task force or there's a change in something name-wise, and then we don't have a standard. So I certainly appreciate that's who's doing it, but I don't know we may have a different entity doing it in 5 years. We don't have to revisit it. So that would be just my comment on that. And the 1 year thing, I think that's probably been said enough about that. So thank you, Mr. Chairman.
Thank you. Further discussion? Sensing none, I believe we're ready for a vote.
Senate File Number 11, Senator Barlow. Senator Bouchard.
Aye.
Senator Dockstader. Senator Hutchings. And Chairman Baldwin. 5 ayes.
Senator Dockstader believes he wants to do this one. Okay, you've got 4, you've got 11. Anything else for the committee this morning? We do have, the meeting announcements will come out, but we do have a meeting on Friday. 3 bills are on the docket for Friday. And I don't have those in front of me. Doreen, do you have those by chance, the numbers, so these can start looking at them? Yeah, you talk a little bit closer to your microphone. I didn't hear you.
Oh, how about Senate File 7 is what you've asked for on Friday at 8 a.m. Senate File 7, the definition of opiate. Senate File 9, Medicaid coverage with licensed pharmacists. Senate File 37, podiatry medical services with Medicaid.
Very good, thank you. And then there's more for Monday, but we won't announce those now. The Narcan, opioid antagonists is a good example of what Senator Barlow was just speaking about, how things change over time. And if we can generalize, it's a big deal. It's important. Nothing else for committee. We'll close out today's meeting. We'll see you all again on Friday, and we'll see you up to the governor's